Yvonne Lassane, what can I take for positional vertigo? I was prescribed Meclizine and I'm now using Dramamine since I don't have any more Meclizine. Could I possibly have swimmer's ear? You could, but probably not. Positional vertigo is from the inner ear. Swimmer's ear is the outer ear, which has nothing to do with balance. The middle ear and the inner ear are specifically affect your balance state and the way that you feel. Positional vertigo is a curse. It is a big problem. And Meclizine is a better therapy for it. You prescribe Meclizine, it means you need to go back to the doctor to get more Meclizine. Dramamine is not a it's a close but not appropriate substitute for that. So I would not. I would get more Meclizine, and you can take it as often as you need to relieve your symptoms. Now, also to decompress the inner ear, you should be using a nasal spray such as Flonase or nasal Cort, and sometimes I will give a patient a mucolytic to promote drainage of the fluid down the eustachian tube. That's my Mucinex again, Mucinex DM, or just plain Mucinex, and sometimes a nonsense. See, the Mucinex will make the fluid thin and watery. Antihistamine will dry the fluid up. So either way, you get benefit from the inner ear. So oftentimes you do that regimen and you will get relief of symptoms. And then as soon as you stop doing it, the symptoms come back. It's just very important that you stay on top of this because that means, positional vertigo, when she bends over, moves her head one way too abruptly, the ear gets involved in the cochlea in the ear, which is your balance center, will react and make you feel dizzy. Now, there's two types. One where you feel like you're spinning, two where the room, you feel like the room is spinning and you're standing still. That gives you greater insight into what the problems can be with vertigo. Vertigo is a challenging diagnosis to make and a very challenging treatment option because there's no take this and you'll be better tomorrow. It's usually a process. And sometimes, trial and error, what works, what doesn't work, what works today may not necessarily even work tomorrow. So vertigo can be a challenge.